The process of childbirth can be summed in three phases of labor. First is the shortening and dilation of the cervix, second is the descent and birth of the child, and last is the birthing or expelling of the placenta. After conception, the gestation period begins immediately and the embryo begins to grow. This begins a 38 to 40-week pregnancy in which the mother has to account for her well-being as well as the child she is carrying. As this small life begins to develop, it is a mother's duty to take precautions against external influences that may adversely affect her baby. It will also be a time to invest in preparation for the final push of childbirth in order to have the best chances at birthing a healthy baby.
First-time moms naturally want to ensure the healthy and normal growth of their babies. As the first trimester is the most critical stage of prenatal development, moms have to be mindful of environmental factors and pregnancy-proof their lives. Scheduling time to visit a doctor to discuss prenatal care has been shown to increase a baby survival rate. Visits should be further scheduled for every month till the third trimester. These visits will help the doctor and mom keep track of hers and the baby's health and growth to be aware of any. Though during this trimester, mom may not look pregnant, her body is undergoing many changes. Nausea and fatigue are common symptoms and should be heeded as warnings to slow down as the body prepares itself to take on new life. Other common symptoms that should not be a cause for worry are light bleeding, breast tenderness, and a milky white discharge called leukorrhea. Also, starting a healthy diet may help with nausea as well as providing nutrients for the baby's development. By the end of the first trimester, a growing fetus has already begun developing a spinal cord and nervous system, has a heartbeat, can move its arms, legs, fingers, and toes, and can smile, frown, suck, and swallow. The second trimester is usually the easiest according to most women. Nausea, fatigue, and mood swings subside, leaving moms with a lot more energy. And as the baby continues to develop, their physical signals will be felt in little movements and hiccups. To keep up with the boost of energy and a growing stomach, a regular pregnancy-friendly workout can be started which can help reduce the aches and pains of pregnancy. It may also help ease labor and getting back in shape after childbirth. Also, in this time, researchers recommend going for a dental checkup. Due to hormonal changes during pregnancy, gums may become inflamed and bleed, which is known as pregnancy gingivitis. If the gum disease is severe, the inflammatory molecules in the bloodstream can likely trigger contractions in the uterine wall, which can cause preterm birth. Doctor visits for prenatal care should be scheduled bi-weekly or weekly in the third trimester to be able to closely monitor development such as the baby's movement and administer physical exams to check on things like the distance between the pubic bone and the top of the uterus, which is called the fundal. This is the time for moms to slow back down and get their bodies prepared for labor. Rest is important because as the baby continues to grow, there will be less room for mom's lungs to expand, leaving her feeling breathless majority of the time. It is crucial for mom to sleep on her left side to allow the passage of blood flow to the baby. By week 33, Braxton Hicks contractions may begin to be felt as the uterus tightens for a few seconds. This should not cause worry as it is not the start of labor. By week 37, for a mom's first pregnancy, a baby will turn into a head-down position and drop into the pelvis, engaging itself for birth.
Smoking cigarettes is probably the #1 cause of adverse outcomes for babies born premature, too small, and babies can even die before they are born. This also can cause serious diseases such as diabetes or high blood pressure. Cigarette smoke contains more than 4,000 chemicals, at least 6,000 cancer-causing compounds. When you smoke during pregnancy, that toxic buro gets into your bloodstream where your baby's only oxygen source. Oxygen can have devastating effects on your baby's growth and development. Under babies whose mothers smoke in the first trimester of pregnancy are more likely to have their heart defect at birth. Smoking during pregnancy can have lifelong effects on your baby as well. Children of pregnant smokers are especially likely to have learning disorders, behavioral problems, and relatively low IQs. Mothers-to-be get headaches and upset stomachs just like everyone else, so it's not uncommon that most pregnant women have used over-the-counter medications. In fact, some data suggests that overall women are actually more likely to use certain medications, including cough and cold drugs, after they become pregnant. But some OTC drugs have been shown to pose risks to developing fetus at different stages of pregnancy.
For example, acetaminophen has long been considered a safer way for pregnant women to reduce fever and alleviate pain rather than non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, and naproxen. Children whose mothers use these pain relievers during pregnancy may be at higher risk for asthma, behavior problems, and attention deficit disorder.
So while it's responsible to treat a fever or occasional severe headache with medication, women who find themselves needing to take a pain reliever several days in a row or more than once every few weeks should consult with their providers to help find and address the underlying cause of their symptoms. During pregnancy, your body protects your baby from most radiation that you're exposed to every day. Most babies born to moms who come in contact with low amounts of radiation during pregnancy aren't at any risk for birth defects. Birth defects can cause problems in overall health and how the body develops or in how the body works. If you swallow or breathe in radiation material during pregnancy, it can get into your bloodstream and pass through the umbilical cord to your baby. It also can build up in areas of your body that are close to your uterus, such as your bladder. The effect on your baby depends on the amount of radiation your body takes in, the kind of radiation it is, and the length of time you're in contact with it. Your baby is most sensitive to radiation between 2 and 18 weeks of pregnancy. Exposure to radiation during pregnancy can slow your baby's growth, cause birth defects, affect your baby's brain and development, cause cancer in your baby, and even cause miscarriage.
Labor and delivery can be a very long and arduous process for mother and baby. It is vital that the mother is prepared for any possible outcomes, such as a premature birth. No matter if it's a home delivery or a hospital delivery, a mother needs to make sure to surround herself with professionals that know exactly what to do in order for both of them to come out healthy in the end. A mother should be aware of all the signs that indicate she is near delivery. Mothers are urged to report to the hospital or contact their midwife when their contractions are consistently 5 minutes apart. Typically, labor can last anywhere between 5 to 18 hours depending on multiple factors. Although it may or may not be a mother's first choice to have a cesarean section, sometimes it is a vital procedure in order to deliver a healthy baby. There are various reasons a doctor may opt for an emergency cesarean section, such as breech position, fetal distress, multiples, failure to progress in labor, and many other factors. As with any surgical procedure, there are benefits and disadvantages to C-sections that need to be carefully considered. Although C-sections can offer conveniences, they also carry risk. There could be damage to the surrounding organs, excessive bleeding, or an infection. 40% or more of women having 3 or more C-sections will experience these complications, so keeping the procedure limited to those that are medically necessary could be life-saving.
The process of childbirth is already a tough one. A mother can optimize her time by putting extra care in the growth of the child in utero. This can be accomplished by listening to your doctor, avoiding harmful substances, and following up with a prenatal care plan. The best a mother-to-be can do is follow the advice of those who have gone before her.